Welcome to TY's Moments of Truth. Today we'll be discussing headaches. I'll take you through the different causes and how different types can be prevented. So the commonest cause of headache is insufficient fluid intake. And when I say fluid intake, I'm not referring to your pints, Carlsberg, or vodkas, no. Fluid in terms of water. You should drink at least 2 liters of water a day. And if you live in the tropics, maybe a bit more, because you'll lose some water through sweating. Secondly, if you drink a lot of caffeine, things like coffee, tea, and carbonated drinks, it can cause headaches. Yes, I'm sorry, I know you like Starbucks, but you need to keep an eye on it. I would say 1 or 2 cups a day is okay. Thirdly, you need to look at your stress level, especially in the weeks preceding the headache. If you've been a bit more stressed, you can get a headache. Fourthly, when were your eyes checked? You need to do an eye test at least every 2 years, because that can cause a headache. Fifth, when was your blood pressure checked? You need to check your blood pressure regularly, because an elevated blood pressure might lead to a headache. Now, most importantly, if you get a headache in certain locations, it might be a sign of stroke or a burst blood vessel. I will go into more detail later on. Now, how do these headaches present? The commonest presentation is what we call a tension headache, which just feels like a band or a dull ache across the forehead. Now, this might be due to insufficient fluid intake or arguing with your boyfriend or your girlfriend. Yes. And also if you're unable to pay your bills. Also, too much caffeine can cause that. Another type of headache, which what we call migraine, is usually one-sided, and you might have problems with your vision. Also, you notice that bright light affects you and it makes the headache worse, so you might want to stay in your room and sleep all day when you get that kind of headache. Now, the most important headache that you should not play with is the type that at the back of your head, or you wake up with the most severe headache you've ever had. Now, that type of headache might be a burst blood vessel or a stroke, so you need to seek medical advice ASAP. Please do not play with that kind of headache. Now, what can we do to prevent these headaches? Number 1, do not go to Dr. Google. Please, I'm begging you. Now, I'm not saying you shouldn't check on the internet. The only thing is, unfortunately, Dr. Google will tell you you either have cancer or you're going to die. And that might not be the case. So I would suggest that you can go to verified medical websites like WebMD or NHS Choices. Now, secondly, you need to check your fluid levels. Water, specifically, like I said, you need to drink at least 2 liters of water a day, and make sure you keep yourself well hydrated throughout the day. Thirdly, you might need to take paracetamol or ibuprofen regularly. And what I mean by regularly is every 4 to 6 hours. And the way you can do that is to take ibuprofen, 3 to 4 hours later, take some paracetamol, 3 to 4 hours later, take some ibuprofen, and just continue that for a few days while the headache settles. You need to get your eyes checked, like I mentioned earlier on, and also get your blood pressure checked, just in case it's any of those. And lastly, if you notice, you do all these things and over a few days it's not going down, please seek medical advice. But you can try these tips at home first of all to see how you go with that. Now, we'll have other topics during these weekly medical series, and I'd like to hear your feedback and also what you would like to hear. So please keep those comments coming, and don't forget to subscribe to my YouTube channel, Toyin. Thank you, and until then, remember to smile because it's healthy. Bye.